India on Wednesday reiterated its continued commitment to supporting Afghanistan's healthcare system and humanitarian requirements during a meeting between Union Health Minister JP Nadda and Afghanistan's Minister of Public Health Maulavi Noor Jalali. According to the Union Health Minister, the two ministers reviewed the existing framework of health cooperation and explored ways to enhance collaboration in areas such as healthcare, infrastructure, supply of essential medicines and medical equipment, and long-term capacity building. Nadda emphasized that India's engagement with Afghanistan has consistently followed a people-focused approach guided by Prime Minister Narendra Modi's vision of prioritizing welfare, skill development and access to essential health services for the Afghan population. He noted that India's assistance continues to be driven by humanitarian considerations and the deep-rooted historical and cultural ties between the people of both countries, irrespective of political developments. The Health Ministry said additional proposals to strengthen Afghanistan's health sector are currently under active consideration. These include initiatives aimed at improving service delivery and addressing gaps in medical care. Capacity building measures were also discussed, with India working on modalities to send a team of senior doctors to Afghanistan. The proposed visit would involve organizing a medical camp and conducting training programs for Afghan healthcare professionals. The meeting reflects India's ongoing efforts to extend humanitarian support to Afghanistan, particularly in critical sectors such as healthcare.